Today I'll be presenting a series of measures that will help move California forward on a number of crucial fronts, especially in healthcare and job creation. The first bill I'll be presenting is AB 2385, which will help spur workforce development in the crucial field of allied health. Specifically, this measure creates a pilot program that will fast-track students in nursing and allied health fields so that they can complete their training and graduate earlier. This bill is a win-win. It's a win for students who move into the workforce sooner, as well as for colleges, which will see needed resources freed for their students, and will finally be a win for the state as well as for the healthcare industry, in that we'll see more professionals moving into the field more quickly. The next measure I'll be presenting is AB 1602, which will conform California's health insurance laws to recently signed federal healthcare reform legislation. The passage of the federal healthcare overhaul was a major victory for California, for the insured population here in California, as well as the uninsured population. And my measure will help ensure that key consumer protections, such as extending dependent coverage to 26, go into effect as quickly as called for in the federal legislation. And finally, I'll be presenting 2352, which expands the length of time Medi-Cal beneficiaries who have received organ transplants are eligible for payment for anti-rejection medications. This is an important measure because it both saves lives and taxpayer money. Organ transplants are amongst the most expensive medical procedures, and extending the length of time a person is eligible to receive anti-rejection meds will ensure the positive health care outcomes resulting from an organ transplant. And so the idea is that we're able to save money by having people sustain the organs that they received in the transplant. One of the most crucial elements is setting up the healthcare exchange, which is required for us to be done before January 1st of this coming year, so that we can fully implement it in 2014. That exchange is crucial in particular for people earning anywhere between the 133 and 400% of the poverty line, because it makes them eligible then for tax credits for purchase of their health care premiums. It allows them to decrease their out-of-pocket costs as well. And so when you're talking about 133 to 400% of the federal poverty level, you're talking about a family of three at anywhere between $24,000 a year and $73,000 a year in income. It's a huge portion of our population in the state. So to make them eligible to get those tax credits, to make small businesses eligible to participate in the exchanges is huge. When you look at middle-class families who have kids in college, and we know that the time to degree has extended in most cases, lifting the age of dependency up to 26 allows for the ability of those families to continue to cover their students, which is a huge issue as well. And so those are some of the elements that we think are particularly helpful.